Hey you guys, so apparently Facebook Live did not want me to be great this afternoon. I have no idea what happened with the broadcast. I've gone live several times from my page and I've never had such an issue. And you guys know I did a live this morning from my personal page and it went perfectly. It went off without a hitch. But for whatever reason, when I got ready to do the live about hysterectomies not being a cure for endometriosis, I guess the little lying information guys did not want me to put the truth out about it, and it kept stalling my broadcast. But where there's a will, there is a way. And so I just decided to record a video and upload it externally because the information is just that vital and just that crucial for me to get out to you guys. And the reason why I was so compelled to do this video is because this has been a hotly debated topic as of late within the endo community, within a lot of the online support communities that I am a part of. And we get new members every day, young women, older women, who don't have a lot of the information that we have, who don't know the things that we know. And so we get a lot of the same questions that come up over and over and over. And this morning we were discussing it in one of the support groups. One of the young ladies made a post, something along the lines of letting us know she had gotten scheduled for her hysterectomy, and she was so excited because no more hysterectomy, no more hormones, no more endo. And she was really excited about that. And of course that set off a flurry of responses from the ladies, all of us chiming in, telling her no, that's not true, that just because you get hysterectomy, you can absolutely still have endo after the fact. And then we had ladies chiming in, expressing their disappointment with the fact that that's what they thought too. They thought that it was going to be a cure-all and that they were going to get their life back, only to be disappointed that the endo was still present. It persisted and it even spread in some cases. And so that prompted me to want to just come and share with you guys the myths about hysterectomies and endo, and why, unbeknownst to me, that this is still being touted within the medical community as being a cure for endometriosis, when it is absolutely, unequivocally, without a doubt, not a cure for endometriosis. And so we wonder then, why are doctors so quick to go to this as a first line of defense, as a first line of treatment, still pushing it as a cure when it's not? And we'll talk about why they do that in a little bit. But I want to talk about 3 key points as to why hysterectomy is not a cure for endometriosis. And the first thing I want to do, for those of you who are new to the page, who are new to the broadcast, who are new to endometriosis, I'm going to start by giving you guys a basic definition of what endometriosis is. So a little bit of biology 101. So every month when a woman's body prepares for conception, right? She prepares to receive a sperm, to her egg, to become fertilized and create, you know, a baby zygote and all that good stuff. But if the egg does not get fertilized, that lining builds up within the uterus, it sheds, it breaks down, and it exits the body in what we commonly refer to as our menstrual cycle or our monthly period. When a woman has endometriosis, cells that mimic those found in the uterus, not the same cells, they're kind of almost mutated, if you will, cells that mimic the activity of those found in the lining of the uterus. Somehow, some way, they're not sure how it happens, but they find themselves embedded in other areas outside of the uterus, but they don't know where they are, and so they act and behave as they were designed to, which means they build up the lining, it builds up, it breaks down, it sheds, and it bleeds out. But because these cells are not in the uterus, it has no way of exiting the body. And so the woman essentially is bleeding internally month after month after month. All of that blood can cause organs and ligaments and tissues to bind and fuse together. It can create cysts and tumors and a whole host of other comorbidities that exist as a result and because of the endometriosis. And so what does that mean for us? For most of the women who have the disease, it means very painful menstrual cycles, inflammation within the body, chronic fatigue, just a whole host of symptoms. And unfortunately, there is no cure for endometriosis. Excision surgery, whereby means they go in and excise the diseased tissue from the body, that has been commonly known as the gold standard of treatment. Aside from that, there are a whole host of medications, basically drugs, combination of treatments, hormonal therapies, drug therapies, all designed basically to manage the pain. And years ago, hysterectomy was touted as a cure for endometriosis. And unfortunately, science, medicine, education, new developments have proven that to be absolutely false. And so why then is it still being so heavily, so quickly, so first thing out of the gate prescribed? It's difficult to say, but I will give you some feedback from a couple of experts and doctors in the field and let you know what they have to say. So let's talk about the first reason why endometriosis is not cured by hysterectomy. I want to talk about the pathology of the disease. By definition, endometriosis is what happens when things that are normally found inside the uterus or similar things are found outside of the uterus. Endometriosis is not specific to the reproductive canal. Most of the time, the reproductive organs are what are affected by endometriosis, but it's not the only thing. So you can have endometriosis in the ovaries, in the fallopian tubes, in the uterus, in the pelvic floor, in the pelvic cavity, but you can also have endometriosis in the bowels. You can also have it in the rectal canal. You can also have it in the vaginal canal. You can have it in rare cases in the lungs, on the kidneys, in my case, around the kidneys, near or on the ureter, and even in rare cases in the brain. And there have been some select cases where men have had endometriosis in the breast, kind of like how men get breast cancer. So if you have endometriosis present in all of those areas, removing the uterus is going to do what? Absolutely nothing. It's still going to be present in the body, thereby more than likely spreading, growing, progressing. So getting a hysterectomy, and if I've got endometriosis, which I do around my ureter, around my kidneys, how is removing my uterus going to help that? It doesn't. And that's the sad, shocking, devastating reality that a lot of women face after they've been told, oh, you get a hysterectomy, you'll get your life back, only to find the disease persists and it grows and it gets worse. And they're devastated. They're shattered. There are some women who know very early on, they're very sure and definitive in the fact that they don't want to have children. So they may not be affected in the same manner. But if you're someone who wants children, who have been trying to conceive, and you let a doctor force a hysterectomy on you at 16, 17, 18, 21, that's a permanent decision. You can't change your mind and be like, oh, the endo is still here. Give me my uterus back. I want to have kids now. That's a permanent, that's forever, forever, ever, forever, ever. It's forever, which is why it baffles me. Why so many more doctors don't take more care and consideration before prescribing this, especially to women and young girls as young as 16 years old. So pathology, the fact that endometriosis persists outside of the body. If you guys scroll down on my Fighting Fiercely page, you'll see an article that I posted September the 14th, was posted in Teen Vogue. And there were several doctors that chimed in, and I just want to share with you what they had to say regarding the pathology of endometriosis and hysterectomies. Dr. Jeffrey Arrington, a contributor to the article, says, the idea that, he says, we are taught in medical school and residency that hysterectomy is a definitive treatment for endometriosis, explains Jeffrey Arrington, MD. The idea that removing the uterus can treat a disease that by definition occurs outside of the uterus is ludicrous and not based on any science that I am aware of. Removing the uterus does not magically make existing endometriosis disappear. That's just what one doctor has to say. Another doctor in the article, Ted Lee, he is the director of minimally invasive gynecologic surgery at McGee Women's Hospital at the University of Pittsburgh Medical Center. He says the structure of our training is very flawed. Being a good physician who can treat endometriosis requires a certain set of skills not easily acquired through the normal OBGYN residency training. The majority of people in residencies will probably never see a good excision during their training. He goes on to say that it's because of this lack of training that many OB-GYNs are not aware that hysterectomies are not an effective treatment for endometriosis. There it is. It's not an effective treatment, and that's kind of the problem that a lot of women face, and it's not really through any fault of their own. It's just doctors aren't trained. Doctors aren't aware. They don't know what to look for. They don't know how to treat. They don't know how to perform successful excision surgery. So they go to what's easy. They go to what's quick for them. And they're affecting women's lives in ways that cannot, be explained. And the difficulty for women who struggle with the disease is that because there are so few specialists in this country who specialize in treating endometriosis, a lot of women have no specialists where they live. In rural areas and smaller towns and cities, they don't have the access. Some of them will have to travel several hours to get to a larger city. Some of them have to go to other states. A few ladies I know have even had to go to Canada, which increases the financial burden that we already have to deal with, because a lot of our care and surgeries and medications are not covered by health insurance. So a lot of women are forced with the dilemma. First of all, a lot of them are not able to work because of the debilitating pain. It's not recognized as a disability, so our income is affected if you don't have a spouse or partner to bring in other income. Women who already have children, they can't afford to travel and go to other states and other hospitals for days and days and days at a time to be away from their job, to be away from their families. They simply cannot afford that. So not having access to an adequate specialist, that increases the financial burden that we have to deal with, which by in turn increases the stress, which in turn increases the physical flare-ups and inflammation and burden on our bodies in dealing with this disease. So pathology in and of itself. Number two, lack of knowledge by doctors in the medical community are just, two of the reasons why it doesn't, effectively, not even effectively, it doesn't cure at all. And I apologize, I'm just trying to find my space here within the article. So Dr. Lee, after explaining that, he goes on to say, when a doctor prescribes hysterectomy for endometriosis, it's because they don't know what else to do. In Dr. Lee's words, if you have a hammer, then everything looks like a nail. So we've got pathology outside of the body. We've got inadequate information, lack of education on the part of doctors in the medical community, not knowing how to adequately treat it, calling it a cure when it is not. Doctors don't know how to perform excision. They don't know the current treatment options with regard to, drugs or even incorporating holistic alternatives. And a lot of women are suffering for that. Again, I can't imagine being 16, 17 years old and being faced with the thought of having to get a hysterectomy. Having to get a hysterectomy. That's a very difficult decision. And again, only to be faced with the fact that in a year or two, or sometimes months later, you're dealing with the same issue all over again. The depression, the psychological, the emotional anguish that comes along with that. It just compounds what we have to deal with as women facing this disease. So we've talked about two things. So number three, the third reason that hysterectomy does not cure endometriosis is because of the hormonal component. Endometriosis is by and large, for the most part, an estrogen-driven or an estrogen-dominant disease. That means that excess estrogen in the body basically feeds the disease. So a lot of doctors are of the thinking that if I remove the uterus, I upset that hormonal balance, I remove that component, no more disease, right? And if you get a hysterectomy at 27, 21, 17, you're gonna go into menopause at 17, 21, 26, which presents in and of itself a whole nother group of issues. But I want to share with you excuse me, what Dr. Andrew Cook, who is a world-renowned endometriosis specialist, he's at the Vital Health Institute, and I believe he's got roughly about 25 years of experience in treating severe cases of endometriosis. And this is what he has to say regarding the hormonal component of endometriosis. And he says, the statement that you cannot have endo after a hysterectomy is scientifically wrong, period. It is well proven endo can and does persist after hysterectomy, both with leaving the ovaries in and taking them out. Endometriosis can produce its own endometriosis, and even without ovaries. Endometriosis can produce its own endometriosis even without ovaries, and it has been shown in studies that endometriosis can have aromatase enzyme activity. Aromatase enzymes make estrogen. So take the uterus out all you want to. Again, if you've got endo in other areas, it can make its own estrogen, and it can replicate its own endometriosis, growing and spreading and persisting within the body. So again, hysterectomy does nothing for that, okay? And there have been women who, have commented and says, well, my mother had it and they took her, she got a hysterectomy and she was fine, or I got it and, I never had any problems with it. If that's the case, and again, I'm not a doctor, so I cannot say with 100% definitive certainty, but again, I've been at this for 8 years, almost 9 now. And what I can tell you is that if you got a hysterectomy and it completely alleviated all of your symptoms, chances are you were misdiagnosed, and what you actually had was what is called adenomyosis, okay? Adenomyosis, again, in very layman's terms, is endometriosis that is infiltrated and embedded within the uterine cavity, within the muscle of the uterus, within the belly, the body of the uterus, okay? So if you have adenomyosis, which is often referred to as the sister disease to endo, yes, hysterectomy does cure adenomyosis, because again, adenomyosis, that is regulated to the uterus. So yes, removing the uterus does cure adenomyosis. So if that's you, again, chances are you were misdiagnosed. Again, doctors don't have the knowledge. They misdiagnose one for the other all the time. So if that's you or someone that you know, again, not a doctor, but I can, with assured confidence, I can say you probably were misdiagnosed, and what you actually had was adenomyosis, which is again why it is so pertinent that you have a competent doctor who knows the difference between the two. If you're like me, someone who has stage 4 aggressive endo and adenomyosis, again, hysterectomy isn't going to help me. And that's part of the battle that I have been fighting for the last 5 years with doctors. Well, the last maybe 3 or 4. My doctor now, we're good. But before I found him, I had to fight for about 3 years. Absolutely not. They wanted to force a hysterectomy on me. And no, why? I have it in my pelvic cavity. I have it in my pelvic floor. I have it around my ureter. I have it around my kidney. Hysterectomy is not going to help that. So no, thank you. Now, I am not here to tell anybody what they should or should not do. I know several endo sisters who have thought it out, weighed their options, and they have decided to proceed and go forth with the hysterectomy. And I completely 100% support that. I'm not against hysterectomy. Again, because for some women, depending on your circumstances, it can be a viable option. What I am against is the shoving and pushing down women's throats of medical options that they may not want, that they may not be comfortable with, and they may not know all of the pros and cons regarding choosing that option until it's too late and they've made a permanent decision that they're not happy with. My job is not to tell you do or don't do. My job is to educate you, to enlighten you, to empower you, to advocate for yourself, to empower you to speak up if that is not an option that you want, to speak out and be bold to say, I'm not ready for that, or I'm not comfortable with that, and to be aware and to understand the ramifications of that, to say, okay, I know that this isn't a cure, but I'm willing to take the chance to get whatever degree of relief that this can provide for me. Awesome. I back you in all of your fierceness with that. But when I talk to women who say, I feel cheated, I feel lied, I feel bullied, I feel like my life is over, I feel like my doctor lied to me because they told me that this was going to take care of everything, this was going to cure everything, and now I can't even have children, and now my husband left me because I can't give him children and he wants a family. That's what I'm against. That's what I have a problem with. So why is it when the first case of endometriosis was discovered in the 1800s, why now in 2017 is there not more progress? Is there not more aware? Is there not more specialists within this area? And I hope I'm saying your name right, Doctor. I know we've conversed a couple times on Facebook, but Dr. John F. Delimba, he is another 20-30 year veteran specializing in the treatment of endometriosis. He made a Facebook post a while back about attending his 35th medical school reunion, and he said that he talked to 2 first-year medical residents, and they were commenting that they had just had a lecture on endometriosis, and so he asked them about it. They said they had a lecture. And you want to know what that lecture was? Out of all of how many 8 years residency, how many other years of residency that they had, they were in their 2nd year already. And with regard to endometriosis, not one book, not one page, not one paper, not one case study, one slide of a presentation covered endometriosis. And the only thing that it said was that 10% of women have it. That's unacceptable. That's unacceptable. He goes on to comment, then we wonder why patients don't get the treatment that they need. Then he goes on to talk that they talked about it in depth. And he says that one of the questions that he's asked is that why is endometriosis either ignored or the doctors just don't understand the disease? And he comments that, it's a difficult answer. It's a difficult question to answer. But he does comment that when the professors and experts in the prestigious medical centers do not disseminate valuable and current is so key, current information, how are the doctors in local communities going to be educated? Patients are the only one that will push for this disease to be treated properly. And he then goes on to encourage us to keep pushing. And that's part of what I do in my advocacy. That's why my movement is called Fighting Fiercely. That's why my mantra is educating, enlightening, and empowering. Don't be afraid to tell these doctors no. It's okay. I remember the first time a doctor tried to recommend a hysterectomy for me. He just came in and said, I'm going to schedule this hysterectomy for you. And they started putting pamphlets in my face, and the nurse came in wanting to schedule me, and I'm like, wait a minute, y'all just dropped a bomb on me. I need to go home and process this and digest this and figure out, is this what I want? They were trying to get me to schedule this life-changing, life-altering medical procedure like within 15 minutes of telling me, that this was his professional recommendation. And I said, no, I'm not going to make that decision right now. I'm not going to schedule that right now. Thank you for the information. I'm going to go home. I'm going to digest it. I'm going to, you know, sit with it. And then I'll make my decision. Needless to say, I never went back because that wasn't something that I wanted to do. So we've covered 4 things, 4 reasons. Pathology, because endo can be present in other areas outside of the uterus. We've covered the hormonal component. Hysterectomy doesn't work because even after the hysterectomy, endo can make its own estrogen. Endo can replicate, make its own endo. The 3rd reason is because doctors are not properly trained. They don't know what to look for. They don't know how to treat it. They don't know what else to do. And lastly, the outdated education. Most doctors' residencies are at least, what, 3-4 years, and you only get 1 slide covering endometriosis. We've got to do better. We deserve better. And so I hope that I have cleared up some myths for you. I have brought some clarity and some facts to some areas, you know, regarding endometriosis that you may not have known. And again, this is not an indictment against women who choose to get a hysterectomy. Again, I support you in whatever decision you make, so long as that decision is a fully informed, fully educated one. And again, doctors don't have all the answers with this thing. It is up to us to educate, enlighten, and empower, and learn from each other, and share with each other, share with the doctors, share with those in the medical community. Because if we don't fight fiercely for us, who's going to do it? You know, we have to fight for each other. Even, you know, Dr. Delimba says we've got to keep pushing. So hopefully I have given you some information of value, some information to take with you on your next doctor's visit, or when you're sitting with your significant other trying to decide if a hysterectomy is right for you. You may decide to go forward with it, but understand it is not a cure. It's not a cure. It's not a quick fix. It's not a one and done. You know, as it stands right now, there is no definitive cure. There's only pain and symptom management. And again, this thing has been around since the 1800s. Meanwhile, men has got Viagra, pumps, creams, lotions, a whole plethora, right, in their arsenal to keep their reproductive system on and popping, right? So I just encourage you guys to keep fighting. We have to. Share this video. Again, if you scroll down my page for September 14th, or scroll through my Fighting Fiercely page, click it, like it. There's all kind of articles, all kind of information. The one I referenced today for Teen Vogue is under the date of September the 15th. When I was doing the live, a couple of people asked me, where can I get the book? If you go into the About page, there's a link, www.fightingfiercely.com. You can get the book there directly from the website. You can also get the Kindle version from Amazon.com. Feel free to inbox me, put questions on the page. I'm here for you, talk with you, listen, support you in any way that I can. We are all in this thing together. Over 176 million of us, women, teens, young girls as young as 9. I'm going to keep fighting. I'm going to keep sharing information, and I'm going to stay in this thing until we find a cure. So take this video, like it, share it, post it, repost it again. Hysterectomy is not a cure, but we're going to keep fighting until we find one. Tomorrow, if the Facebook Live gods agree with me, I'm going to come to you and do another post. Another hot topic is Lupron, yay or nay. And I'm going to talk with you guys a little bit about that. But thank you for taking the time to watch this. I hope that this helped you out. I love you guys, and keep fighting.